Hi, everyone. This is Lynn Lee from Vested. Welcome to our session, Pivoting Technology-Based Programs in Response to the COVID-19 Pandemic, Lessons Learned. Our presenters, Kirk Walter, Mingyu Feng, Heidi Flynn, and Brian Macklin will focus on lessons learned from the development, implementation, and impact of technology-based interventions before and after COVID-19, and strategies used to adapt to hybrid models of instruction to meet students' needs due to continued impact of COVID-19. Let's welcome our first presenter, Kirk.
My name is Kirk Walters. I'm a Senior Managing Director at Wested, and my colleague, Rachel Garrett from AIR, are presenting on an effectiveness study of assessments. Thanks for being here. The presentation today, I'll give you a little bit of background on the study, describe briefly what the assessments program is, explain the study design, which was interrupted a bit by COVID, but we were able to complete the study. I'll share the key findings, and then there'll be a very brief discussion at the end. So if you pick up a newspaper or wherever you get your news, you know that US math achievement is not where it needs to be. When you look at some of the tests like the National Domestic Assessments, the National Assessment of Education Progress, or international assessments such as the PISA, we're not doing as well as we would like to. More than half of 8th graders have failed to reach the proficient level on NAEP recently. There's a similar sort of pattern on the PISA. We know that math is important not only for college and careers, especially in the STEM fields, but also for citizenship, understanding data, being able to think, having number sense, really important for citizenship too. And assessments is one of the few programs that has prior evidence of improving student math learning, which is why this study is an effectiveness study building on a prior efficacy study. So the previous study was carried out in Maine. It was a randomized control trial. There were 43 students, 43 schools, more than 2,800 students. A well-designed, implemented randomized trial that after 2 years of using assessments, students in the treatment group who received assessments scored 0.18 standard deviations higher on a standardized math assessment, the Terra Nova. Notably, the effects were actually larger for students who had lower prior achievement, which was encouraging. On average, teachers used assessments 14 hours or so across the year. This amounted to using it 2 or 3 times a week. So what is assessments? It's an online formative assessment tool that supports independent practice, and it's quite simple for teachers to use. There are 4 steps here that kind of describe how a teacher might use it. So in the first step, teachers select problems from their own curriculum that they want students to work on for independent practice. So this is not generated from AI or from computer. This is teacher selection. Then students solve the problems online or offline. If they download their assignment, they can work on the bus or wherever and still get immediate feedback, whether they got the question right or wrong. Teachers get a report that summarizes the data by student and by item from the homework assignment. And then they use that in the last step to provide feedback and support to students, whether it's the next morning, focusing on problems that were most problematic. To give you just a quick view of the teacher report, you can see, and actually the program has been updated since we did the study. The user, the UX is a little different, but it's quite simple. You can look at the item that you assigned, or you can look at the student and identify sort of how best to spend your time reviewing as a math teacher, as opposed to spending the whole class reviewing homework, which can happen sometimes. Our study design was a school level random assignment. We had 51 schools in our analytic sample spread across 2 cohorts. So you can see in this visual here, in the 2018-19 school year, we had our first cohort of 37 schools. We added a second cohort in the 2019-20 school year, and then COVID hit just as we were really getting going with our full sample. We were able to convince the treatment schools to continue using assessments another year after the pandemic. And we were also able to convince the control schools to wait another year to receive assessments as as the delayed treatment. So as you can see, despite the interruption, we were able to complete the study by extending it an additional year. The research questions were, we had a question about fidelity. To what extent did schools use assessments with fidelity? Our second question related to service contrast. We were interested in understanding what the business as usual math instruction was. And then our third question was, what's the impact of students who were randomly assigned to receive assessments on their math attitudes toward math learning, and their math performance? Our fidelity measure was based on teacher usage of the system. We were able to gather those data, as well as the extent to which they participated in a summer training or follow-up virtual mentoring sessions. And for usage, we counted usage if teachers released an assignment or if they opened a report like the one that I just showed you. Either one of those counted as usage. And the average weekly usage was the number of days with any usage divided by the unique weeks with any usage. So if the teacher did not use it in a given week, that we did not count that in terms of weekly usage. We included the summer trainings from the 2019-20 school year in 2021, but we used usage from the 2021 school year after the pandemic, the year that was most severely impacted by the pandemic, which was the 2019-20. For service contrast, we had an end-of-year survey where we asked teachers questions about the types of computer-supported programs they used for independent practice and homework, and then we also recorded the names of those programs, the frequency of use, the availability of data reports, etc. Our student outcomes were validated constructs on an end-of-year student survey that got at math attitudes. We used the district or state mandated test for our math performance outcome. And the analytic sample included students with survey data from spring 2021 and math performance from either winter or spring of 2021. Our main impacts on student outcomes. So we did not find that being assigned to the assessments group had a significant impact on student math performance or attitudes. As you can see from the exhibit there, the assessments and the business as usual group were quite similar in terms of the distribution. The math attitudes that we were measuring were challenge, engagement, self-monitoring, persistence, and confidence. These are items that have been used in prior studies. We did sensitivity analyses. We looked at moderators. We looked at whether there was an association between usage and student outcomes, and we did not find anything there in our exploratory analyses either on student outcomes. We had a few hypotheses for why the null effects. We know that implementation was quite low. As I mentioned initially in the prior efficacy study, teachers were using assessments 14 hours over the course of the school year, 2 to 3 times a week. We had significant number of teachers that didn't even use the program. So the overall averages, the number of hours was much lower in our study. The frequency was wasn't 2 to 3 times a week on average. It was lower than that. We also found a pretty weak service contrast. So teachers reported in the business as usual group, 85% of teachers in the business as usual group reported using products that were similar to assessments in terms of providing feedback to students. And I think that probably diluted the effects. And understandably, we know that all teachers were forced to use the web to some extent during COVID. And it's also worth noting here that assessments was not specifically designed for fully remote instruction. It was really designed to help teachers in face-to-face settings. utilize and to provide students with individual feedback on their work. So we were able to continue the study through the pandemic because it is a tool that can be used online, but it wasn't necessarily designed explicitly for that use. So in conclusion, the program assessments has continued to evolve since we did our study and the version of assessments that we used. It has lots of different features now. It continues to evolve. Our job was to see whether and how the similar model that was used in the prior efficacy study held up in a national effectiveness study. So that's worth noting. And I also think it's important that replicating interventions that have technology components may be susceptible to sort of the pace with which educational technology changes and the uptake of those technologies. So the fact that assessments is a quite different product now than it was is something to sort of take into account when you're studying interventions like this. Thank you for your time. And if you have any questions related to the design, there's lots more details that I'm happy to share with you or my colleague, Rachel Garrett. Our emails are there and appreciate your time. Thanks.
Hey everyone, this is Ming Fen. I'm a senior research associate from WestEd. So following Kirk's presentation, I'm going to talk about a replication study where we continue examining efficacy of assessments program. Here's an overview of the presentation. I'll give some background information and the rationale specifically for the replication study, and then quickly go over the study design and talk about the sample in our study. And then I'll switch to talk about the influence of COVID-19 on the study and how we made change in response to that, and then share some findings from the study after we made those changes. If you watch the Kirk's presentation, you can see this slide was stolen from Kirk. I only want to add some little details about assessments usage. Because it's an online program and it had some strong prior evidence. And over the past 2 years, assessments usage in school has increased significantly. Initially, before the pandemic, I think they only have like 800 teachers. But by the end of 2021, there are over 20,000 teachers and their students have used assessments to some extent, more or less. And in the year of 2021, WWC conducted a rapid review to synthesize existing evidence in online programs that promote learning. And assessments was one of the few digital learning programs recommended for use in response to COVID-19 pandemic. So therefore, we feel it's important that we talk about this program and report findings from the study that we have seen. So Kirk has already talked about what is assessments. I'm just kind of putting this there and adding in a little bit details here and there. So step 1 would be teachers making assignments in the system. That is a pretty straightforward process. And then once the teacher made the assignment, the students can go into the system and work on the assigned problems. And they got immediate feedback. And there are also going to be progress bars. You can see number 2 that indicates the number of attempts the students made on the problem. And they eventually need to see the right answer. So if they click the show answer button, the system will tell you the answer. There is also a progress bar on the left that the students can track their progress and see how many problems they have left to complete in this assignment. Step 3 would be for teachers to looking at the report from the system, as Kirk showed, to see who are the students having trouble finishing the assignment, how many problems they got wrong, or what are the problems or skills associated with these problems that the students having trouble with, so that they know where the students need extra help. and so that their plan, they can make a plan for the next day's homework review. Right here in this screenshot, you can see that this is one teacher sharing anonymously a report with her student, and also she's reviewing some common round answers with her student. So as Kirk mentioned, there has been a efficacy study supported by IES that found significant results. Overall, there is an effect for the whole population in the sample, and also a strong effect for lower students with lower prior performance. For the low performing group, I believe the effect size was like 0.29. That was really high. So the rationale for us to carry along with the replication study, which actually happened around the same time as the effectiveness study, is that we want to run the efficacy study in a population with demographics that's closely match the student demographics across the US comparing to Maine. And we want to use a policy relevant outcome measure. The Terra Nova test was used as the outcome measure in Maine, which is a shelf available, commercially available test, because at that time there was no state test in Maine. The third reason is that for the replication study, we want to use a local coach for teacher support instead of someone from the developers team to see whether the program can be scaled to a place where the developer can hand off the support a little bit. The research question for the replication study matched with the original study. It covers students' overall learning outcome in math. And we also examine the differential impact by subgroups according students' prior performance level, ethnicity and race, and also their socioeconomic status. And we also look at the impact on teachers' practice as well as implementation fidelity. So the study design is also kind of mimicked the original efficacy study and similar to the effectiveness study that Kirk mentioned, but instead we only have one cohort. In the year of 2018-19, the teachers got warmed up with assessments. They learned to use the program with their current cohort of students in 7th grade. Well, at the same time, our study students, they were in their 6th grade. There was no intervention assessments provided to them. Anyone was told that students shouldn't be exposed to assessments in 6th grade. And then in the next year, 2019-20, we come in and want to measure students' learning outcome when the students move to 7th grade. And teachers used assessments in their classroom making assignments, and the students use assessments to complete their homework assignment or classroom work assignment. Since this is an efficacy study, there have been a quite extensive support for teachers. Teachers receive 2 days of summer workshop each year in 2018 and again in 2019. The local coach provided 2 to 3 in-person visits, and he was driving around and coming to the classroom, sometimes demonstrate how to use the report, and sometimes just trying to tag some issues that the teacher have when using the program. So here's a quick overview of the sample of this replication study. We have enrolled 63 schools, including 102 7th grade math teachers in North Carolina for this study. You can see that actually this sample, in terms of the number of percentage of students in each subgroup or their socioeconomic status or number of rural schools in the sample, it actually matches with the North Carolina population as well as the United States national population quite well. The sample in the original study in Maine was on the right. You can see it's very mostly white students with much less of students in other groups. So this sample, according to a generalizability analysis, is quite generalizable, and we have almost like a 0.9 index number for this sample for the national-wide population as the reference. So as many other studies, this replication study was affected by COVID-19 mostly in two ways. So the implementation was interrupted in spring 2020 when our treatment group finishing the last quarter of their implementation of assessments. And also we missed the outcome measure when the state announced that the state test was canceled in spring 2020. So I'll talk about what we did in response to these two changes. So first is about implementation. In spring 2020, when schools have to close for about 2 or 3 weeks, and then the schools coming up with remote learning plan, and majority of the schools going back to remote learning I think in April. Because this assessments program is online, and then we have about half of the teachers, actually 43% of the teachers continued using assessments consistently after their school settled on remote learning mode. And here we presented the results comparing teachers pre-COVID use and their during COVID use. During COVID time, we're specifically looking at the usage in through March 15th until the end of the school year. Interestingly, that we found the teachers actually view reports more frequently, which one is like the second row here in the table. The teachers view reports more frequently during COVID, but however, the students' usage decreased, and they don't spend as much time in assessments during COVID, as well as like completing assignments as much. So this is like due to different factors happening during that time, but it's interesting observation. Another thing that we did to try to understand the use of assessments before and during COVID was we added a case study that was not in the original design of the RCT. We were able to do survey and interview of assessments users. This is not limited to only the study participant. And we asked two major research questions. How did the teacher implement assessments prior to COVID-19 and during COVID-19? And also, how did assessments affect teachers' instructional practices before and during COVID-19? The interview and survey data suggested that teacher use actually did not change significantly from in-person to remote instruction, and they still use assessments for both classwork and homework. And teachers consistently report that assessments reports changed how they determine if their students have understand their lesson or what the struggles students have, and how they determine what problems or content they should use during their homework review time. And they do use reports or the data coming from the reports to adjust their instruction. They change their lesson plan or pick which small group of students to work with. And the last interesting finding is that we found teachers' attitude towards homework changed during assessments use. In general, teachers reported that they feel more value in homework now that they can use assessments for their homework assignment. So now I'm going to talk about the outcome measure, because the moment we heard that the state canceled the end of grade test, we decided to give our sample a quick supplemental assessment in spring 2020. I think the test happened in late April. We put that together and administered a grade 8 readiness test, the MDTP test, There are studies that before showed the good alignment between MDTP and the Common Core standards, as well as good reliability of the test. And indeed, even during our own administration, we also have good reliability data. The correlation of the students' score on MDTP correlates with their prior year's state test results at a 0.68, and also the reliability is quite high at 0.9. But we also thought about the test, and we don't know if the validity is fully there, 100% there, because the test was not designed to be used in an at-home environment when students are trying to get online and do the test, while their teachers are trying to proctor the test at a different location. And also due to several factors, in school, and also there is a limited uneven access to technology at home. It's a really bad timing. And students, teachers, and schools, there are so many things going on, and everyone is trying to figure out how to do schooling. And this is a very short notice. So we suffered from all of that and had a quite high attrition due to these factors. In the amount of data that we collected, we conducted HLM analysis, but the analysis did not show difference between treatment and control group on the MDTP results. So that's similar to what Kirk reported out, but the difference is that we didn't try to extend the study into a third year. Everybody wrapped up by the end of 2020. The usage and fidelity measure, we all looked at teachers' usage during the 2019 and 20 school year. So here comes some good news. On top of the originally designed RCT, we conducted a follow-up study to examine long-term effect of assessments at 8th grade. Because we weren't able to look at the students' 7th grade outcome using the state standardized test, we went on longitudinally keep the students in the same condition into 8th grade, and then we collected the 8th grade end of grade test from the state database. So this is an intent to treat analysis. We included all students who were enrolled in any of the 63 schools in the year of 2018-19. In total, there are over about 6,000 students who have 6th grade EOG test in spring 2019, and also 8th grade EOG math test score at the end of the school year 2021. So we conducted 2-level HLM model, students nested within school, controlling for 6th grade EOG test score, and many other covariates at the students and school level. This ITT analysis actually showed a statistically significant difference between treatment and control group in favor of the treatment group using assessments. The Hedges G effect size is 0.1. On top of that, we also detected interaction effects. The results suggested the minority group, which is non-white students that we combined all of them together, benefited from assessments more than white students. And the results was more significant and more profound for Hispanic students group. So to quickly wrap up, we just talked about as the digital learning platform. Assessments implementation was also influenced by COVID-19, but we were able to continue the implementation to some extent through the pandemic. And the studies shows the impact on teachers' practice consistently, and this was reported in the original study in Maine. We found it in the RCT, in the replication study, as well as in the case study with a more spread sample. We weren't able to detect the impact using the supplemental immediate outcome. However, a long-term effect was detected 1 year after the intervention was finished. And I also want to say that during 8th grade, there was no intervention provided to any of the schools. We're still trying to find out if there is any students or teachers picked up the usage of assessment by themselves. And also we're doing more investigation in the interaction effect and also the relationship between usage, if any, with the students' learning outcome. We're also trying to benchmarking the effect size and also trying to calculate some measures of cost effectiveness of this long-term effect. If you have any questions, feel free to email me or ask at the end of the session. Thank you so much for your time and attention.
And I'm Kylie Flynn from Wested. Looking forward to talking to you today about an efficacy study we did on improving social emotional skills through a game-based virtual program. Just to give you a brief orientation to the presentation. We'll start with a brief study rationale, a description of the intervention, the study design, our implementation context within the pandemic, our results, and a brief discussion. So growth in social skills is a really important development in elementary school, and children with poor social skills are at increased risk for bullying and other poor school outcomes. The availability of in-person social skills interventions are limited because schools are typically under-resourced to provide such interventions. So we believe that leveraging technology can be helpful to overcome these barriers and deliver social skills interventions with fidelity. So I'll provide a description of the intervention. This is sort of the map that orientates students on the online game-based platform. Adventures is it was developed from an evidence-based in-person intervention and was adapted into an engaging digital version. It's a story-based learning video game developed to help children build social emotional skills and the confidence to do so in a safe environment. Players join the crew of the sailing SS Gren as a new recruit. They learn that villains are attempting to steal the friendship stones hidden around the island, and players must prove their skills to the keeper of each friendship stone by helping the inhabitants of the island with different obstacles. It's true to life, and they're guided by characters that represent different critical social emotional skills that are aligned to Castle, and they work to save friendship on the island. These are the characters, and each one represents one of those skills that I was talking about. So Archie, for example, teaches respect. Action Plan Annie teaches thinking ahead. Stop and Think Girls teaches stop and think. Communication Kid teaches communication. They're all pretty self-explanatory and engaging characters. There are also corresponding posters of these characters to help students remind them about the skills that they represent. Play is a fundamental way that children learn. The avatar allows the students to personalize their character, making the games feel a little more real and personalized. Student choices drives the opportunities, keeping them engaged and invested in the game outcome. And it gives them an opportunity to practice these real life scenarios in a safe place to then develop the social skills they need to apply them to relative situations in the classroom, on the playground, and other areas of their community and school. Students get in the moment feedback during the practice activities. So if they make an error in the choice, the system provides some feedback to guide them. And achievements along the way are provided to develop mini goals and keep them engaged and rewarded. There are quizzes at the end of each section to test their mastery of the material. And then those quizzes lead to tokens that they can then use to play mini games. So the study design was a randomized control trial, multi-site clusters. We had 88 classrooms across 37 schools from 4 districts, and there were 2 cohorts. Classroom level random assignment was at 3rd grade. So you can see here we had an even number of treatment and business as usual classrooms across 3rd grade. There were a few more students in the BAU group just based on classroom sizes. Our outcome measures. We did use a screener. Of course, that only happened at the beginning of the study. We used the DESA Mini, and that allowed, and the teachers filled that out, and that allowed us to identify students who may be at risk at that time of the school year in their social emotional development. Study activities took place primarily after the winter break because we wanted teachers to have some time in the fall to get to know the students. Teachers then also provided ratings on a couple of other measures, the social skills behavior index, as well as the behavior and emotional rating scale. And they did that for students who were identified on the mini DESA as being at risk in their social emotional learning development, and also another subgroup of students who were not identified as being at risk. There were also 2 direct student measures. The ZooU had similar kind of game-based scenes and was our proximal measure in terms of being aligned to the intervention. And the SEL Web provided more of a distal measure. For implementation measures, we had some gameplay analytics, weekly teacher logs, teacher interviews and surveys. The logs just provided some information about how they were implementing whole class, small group, synchronous or asynchronous. We had to add that after the pandemic. I'll talk more about that. Which students were attending and the content covered. The surveys focused on how students were engaged during their use of the intervention, implementation successes and challenges, as well as schools' existing SEL programs. So unlike many of you, our project was disrupted by the pandemic, and I'll talk a little bit about how it was intended to be implemented and then how we pivoted during the pandemic. So the pre-study activities, of course, were those screeners and behavior rating scales completed by the teachers. Students completed their direct measures online. In fact, the teacher measures were also done online. So all of the data collection happened online, which ended up working in our favor during the pandemic. The implementation of adventures also happens online. There are 9 episodes, 1 episode per week. They last about 30 to 40 minutes. And we allowed teachers an 11-week window to implement all 9. So they had a couple of weeks to make up for absences. And then the post-study activities included the same teacher behavior rating scales and student assessments. So we were really well into the study during our first cohort until we were, I think, about 6 weeks of the intervention and when the stay-at-home order happened. And we paused the study for 4 weeks as everybody was sort of trying to figure out what the next steps would be, and restarted April 6th of 2020. During that time, during that 4-week window, we were in really close communication with the teachers, both treatment and control, to talk about whether or not they thought it was possible to complete the study activities remotely. We were very relieved that all but 1 teacher agreed to move forward. And the treatment teachers actually welcomed the opportunity to have something they could assign remotely that the children liked and were familiar with. So we think that really helped. And this meant that the last few episodes of the intervention happened in distance learning, and that post-assessment data was collected remotely. We assisted teachers with that. We would log into Zoom rooms with them to help as much as possible to oversee that data collection. And baseline equivalence was established for cohort 1. Cohort 2 in California, as you may or may not know, we remained fairly distant during the following school year, the 2021 school year. But because we were working in the spring semester, when students started to return to a hybrid, that happened after the winter. So, but 1 district did remain fully remote. So that meant that Pre-study and post-assessments happened at school or at home, depending on the learning environment. And treatment students also used adventures at home and or at school. Again, baseline equivalence was established. So as indicated in this table here, you can see that treatment and control groups were equivalent at baseline. In particular, the SEL web measure satisfied baseline equivalence requirements and no statistical adjustments were needed in the impact model. For ZUU, SSBI, and the BERS, measures satisfied the baseline equivalence requirement after some statistical adjustments in the impact model. The corresponding baseline data was included as a covariate for all outcome variables to yield more precise impact estimates. So the result, the estimated average treatment effect was statistically significant between the treatment and control groups for both of our direct student assessments, ZUU and SEL Web. And it was also, the estimated average treatment effect as measured by the BERS was also statistically significant, although you can see that the effect sizes for the HGs there were quite meaningful for ZUU and SEL Web, a little more modest for BERS. And even though SSBI, it appeared that the treatment students received higher ratings than the control students, there was no statistical significance for that outcome measure. We also looked at these analyses for those students who were identified with social emotional challenges based on the mini DESA, and we had a similar pattern of findings with the ZUU and SEL Web, again with fairly meaningful effect sizes. But however, the teacher measures were not statistically significant, although the effect sizes for both were around 0.20, as you can see there. So one unique feature of being in the middle of a efficacy study of an SEL intervention was that in the middle of the pandemic was that SEL became very important and something that teachers and school districts were really wanting to address. There were a lot of additional stressors associated with the pandemic in the home environment as well as the school environment. So it did sort of elevate the need for high quality SEL interventions and ones that can be implemented with a high degree of fidelity with minimal burden. Even though we're sort of post-pandemic now, school districts are still recovering. And so we were pleased that we were able to pivot and carry out our study activities in the midst of the pandemic. We were delighted that there were some meaningful impacts of adventures despite the disruption and instability caused by the pandemic, suggesting that adventures could address social emotional learning, which is still pretty critical post-pandemic, and provide a flexible option for us for supplementing SEL instruction during in-class or distance learning environments. That said, there were some limitations, particularly related to the pandemic. The use of the DESA Mini for the second cohort of teachers was a challenge because the teachers at that point, at the point in the school year when they were administering and completing the mini DESA, or DESA Mini, excuse me, they hadn't actually met their students in person for all that long. In one district, they hadn't met them at all in person. It was all based on remote learning. And in the other 3 districts, they were just getting to know them in person. And teachers did, in our conversations with them, they did indicate that it was possible they would overinflate the number of students who were eligible or qualified, identified as having those social emotional challenges, because if students weren't engaged in distance learning, teachers were worried about them. It didn't necessarily mean that they had social emotional learning challenges or poor social skills. The teachers just felt like they didn't have as much context for rating them. And that did sort of play out in the data. There were more students identified in the second cohort than in the first cohort. Of course, some of that could also be related to some of the SEL challenges that were elevated during the pandemic. So that is a limitation as it relates to the findings for those students. We also didn't get any state assessment data, which I know happened to everybody, but that was part of our research design. Directions for future research, we're definitely looking forward to the opportunity to replicate these study procedures with hopefully out any pandemic disruption. And we'd like to look at it at 4th and 5th grade, and then of course use state assessment data, but more importantly, follow students into the transition into middle school. We think those will be some important next steps. A lot more to unpack here. We're looking forward to your discussion questions in the Q&A. In the meantime, feel free to reach out to myself or my colleague, Lin Lee, who was the principal investigator for this project.
Hi, everyone. My name is Brian Matlin. I'm a senior researcher at WestEd, and I'm going to talk today about formative research we do on early stage ed tech products. So in contrast to some of the other talks, or I think all of the other talks who have more developed products and we're doing efficacy studies, I'm going to instead focus on how we engage with partner ed tech developers at the early stages. Oftentimes it may just be a concept for the ed tech product or a very early stage version of it, and little to no formative research has been done before. So kind of a different side of the spectrum of the development cycle. This is work I do with a lot of people at WestEd, including some of the presenters you've seen, but also with my collaborator, Jessica Triant, who unfortunately cannot make it today and put together many of these slides. So I will, the good news is she'll be at the conference, so we can ask her lots of questions, but I will do my best to do justice to her slides, but probably won't quite get there. So here's an overview. I'll talk about our portfolio. The most frequent way we engage with early stage tech companies is through the SBIR award, and that stands for Small Business Innovation Research Grants, of which IES funds, and there are other funding mechanisms for SBIRs for EdTech, including NSF and NIH, but a lot of our work is through IES. So in fact, many or some of the attendees may be actually awardees of this award. And these are grants given to the developers, to the EdTech, for-profit EdTech companies, to develop their product and conduct formative research to really make sure it's useful for educational settings. And that's kind of where WestEd comes in. So I'll talk about how we partner with these companies. I'll also talk about some of the things the challenges we've encountered with, in particular with these types of awards. And I think a lot of the challenges are not necessarily revolutionary or new to many of the people probably in the audience, are unique, but I'll talk about some of the lessons learned. And again, I don't think some of the things we've learned are necessarily things we didn't know before, but in general, what I think we learned is how important what we knew before actually is. So I'll kind of unpack that a little bit, but just to sort of forecast there. Okay, so I mentioned this SBIR award, Small Business Innovation Research Grants. We work with companies, sometimes as small as 2 people, or really early stage companies and really early stage products and the goal is to help those companies think through their product and what it's trying to do to utilize what we know about learning and design for learning to improve those products. And then also, of course, to test the assumptions that the product is making about what it can do at the earliest stages. And I think that's super important because it sets you off on the right track to develop more effective and usable products for the classroom. And so WestEd, collaborates with these companies with these kinds of expertise. Okay, so anyone who probably has been to a talk of mine knows I'm a fan of logic models, and I think in this context they're particularly important. And just in case anyone's unfamiliar with the logic model, it's just the articulation of what the product does or is intending to do, and not just the outcomes, but also how it's supposed to be used in context. What are the activities that people are supposed to engage with? What are the core components of the product? And core meaning if you took them away, you wouldn't get the impacts. And I think articulating this is really important for several reasons. One, or at least two. One is that this EdTech development is inevitably an interdisciplinary exercise. You might have software developers, business people, researchers, curriculum developers, etc. And articulating the logic model gives it a shared language and a shared vision for what the product's supposed to do. But the second reason that I think it's really important is that it forces you to articulate what your assumptions are about the product. And again, not just about the outcomes, but about how it's supposed to be used. And that's critical. And I think, so I think some of the other talks when we were forced to go into the remote learning context during the pandemic kind of highlighted like why we have to really take some time to logic model out and think about how the product's supposed to be used, because the remote context is a new use case. And so so anyway, what it allows us to do is make explicit those assumptions about the usage, and then we can test those, because and that's important, because like the most innovative products go nowhere if they aren't usable, if you can't engage with them the way that they're expected to. And so so that's why we do this, and it's more than just a theoretical exercise. Okay, I talked to a lot of, and I realize I may be preaching the choir here, but we start with doing this formative testing before we go into studies of promise at the early stages, and I talk with a lot of companies almost monthly and have this conversation about why we can't just skip to the study of promise or the more rigorous RCT, because it's a healthy belief in the product, I think, from the developers, that it motivates, they believe it works, so they just need the evidence, the top ESSA standard study and the WWC without reservation study, so they can say they got that evidence, and they're pretty confident it's going to work. And that's healthy to believe, I think, if you're a developer, because it motivates you, helps you sell products, and that's good. At the same time, our job as evaluators is to really question the assumptions about the product and really test them out in early stages. So in other words, it's really risky to go to these studies of promise as a first step, because if you don't find effects, or worse, if you find negative effects, trying to explain those becomes really difficult, because you didn't do the startup work to really formally test how people engage with it and work out the kinks. So then you're left having spent lots of resources and money on time on a study that didn't show you anything. So we try to set these companies up for success by doing the early stage formative research. And again, while that may be obvious to some of the people in the audience, I think I have that conversation almost monthly with developers, and I think it's really important to do this formative testing. Yeah, like I mean, I think there was a lot of there are now a lot of educational technology tools. So I think there was this sort of, maybe this is an exaggeration, but kind of this sentiment of pre-pandemic, I think that, or at the early stage of the pandemic, that technology-based products are going to be sort of immune to the remote learning context, or something along the lines of, because they're technology-based, they will just be, do well when we have to use them remotely because, it relies on technology. Maybe I'm mischaracterizing that, but I think that changed. I think we learned that these technology companies or products, despite being technology based, are not necessarily immune to the challenges of remote learning. And so I think one way going forward to try to protect against that is to utilize this logic model approach informative testing program for the remote learning context. Again, I think lots of these challenges we kind of knew about, or maybe aren't new, but maybe one to highlight is the sort of equity aspect of technology and its implications. I mean, educational technology, I think, has great promise to improve educational equity, but at the same time, I think we learned in the remote schooling context, especially, that it also, can inadvertently exacerbate inequities. More affluent schools can afford more technologies. Students at home may not have access to the technology for various reasons. So I think, even if the product is in theory able to support students from less, strong background or economic backgrounds, it doesn't necessarily mean they will in practice. And again, another reason why I think we have to think through the use and context and how that's going to actually be accessible. Okay, a lot of these are my collaborator slides, but I think I kind of front-loaded the logic model. You guys know I'm a fan, yeah, and I think I've been talking about a lot of these, so I'm going to move on here. Studying implementation. Here, I guess I would just highlight, and again, Jessica will be available at the meeting, but so we can ask her questions. But I think I would just highlight that, especially in the early stages, but even in like efficacy studies, the questions that having support built in so that teachers on the research side, so that teachers can ask lots of questions and get the technology up, running to the point where it can be used effectively is important. So having that staff capacity, and then also like building in a plan to document that kind of those exchanges, because the types of questions that teachers have and the types of issues that they experience are all, I mean, for me, they're data points. They help to understand like how to make the product better. And so anyway, that's part of the implementation feedback. And then finally, with dissemination, we all know that it's important to engage meaningfully with our district and school partners. But I think hopefully in the next 10 years, we really move towards a model of true collaboration with districts and schools, like really trying to understand what's useful for them and engage in longer term partnerships, and not have to just recruit to get numbers, but to have meaningful collaborations, because I think those district and school and teacher partners those kinds of discussions can actually contribute to driving the science and driving our research questions in ways that are meaningful. So just to conclude, again, not necessarily revolutionary talk, but I think emphasizing we learned what we knew was really important, and it's true in the remote context too. And so you know, ed tech really needs to think through how the product is supposed to be used in the remote learning context in order to support that learning. And going forward, if hybrid types of use cases are going to be more common, then we need to like think through that in our early stage development. Of course, if you have any questions, we'll be here, and you can email us as well. Thanks.
So if anybody has any comments, questions about any of the presentations, I think you can either put them in the Q&A chat or just come off mute. I think we're a small enough group that we can keep it fairly informal.
I guess I have a quick question for Brian. When you do subject matter experts for your SBIR grantees, where do you find them? Are they typically the ones in-house from West Ed, or do you have contacts external that you kind of keep?
Yeah, we usually recruit them from West Ed. We have many different programs at West Ed that cover all kinds of different areas. So we're usually able to find that expertise in-house. But we're not opposed to asking out for external help. Yeah, Jessica, anything you wanted to add to that?
No, I was going to say the same thing. We have a lot of great experts at West Ed, so we call on them often.
All right, I'll ask a question. Actually, Rachel and Kirk, I didn't get to see yours. I somehow had trouble logging in, but I saw the tail end of Mingyu's study. And in case people didn't notice, one study actually reports a big positive result, another one reports a null result. Ming, you didn't actually wind up saying anything about comparing them, but nationally speaking, we should try to actually think about that. What are the two of you think about how you should think about them together, taken in context?
Yeah, I think actually Rachel, Kirk, and I, we were just talking about that before the official start of the Q&A session. While we were kind of in this room and chatting, we thought about several things that we could do to come up with hypotheses. I guess we don't know for sure, right? So these two studies, one thing we talked about was the timeline. Like the national study has the primary outcome year as the 2021. But and that's like most of the schools are doing remote learning, I believe. But for the study in North Carolina, the students were in 7th grade in the 1920 school year. The end of the school year got interrupted, but most of the school year were normal. And the teacher got trained in the 18-19 school year. So that was a very normal year as well. So I don't know which study got influenced by COVID more or less. So that's one factor that we thought of. But I mean, we both have usage data. So that's something that we can compare across the two studies in terms of implementation dosage and see how much has been used. Right, Kirk?
Yeah, and Rachel, you should chime in too. We're pretty sure that usage was much higher in the North Carolina study than it was in ours, just based on the slides, but we should dig in more deeply. And then we also had a really weak service contrast. And I can't remember, Mingyu, what was your service contrast like in North Carolina? Was it pretty strong?
You mean in terms of use of the platform or the PD, right?
So in the comparison schools, we found that they were using a lot of technology-based products with similar features to assessments. And so in that 2020-2021 school year, which, as you said, was more remote and virtual than anybody had intended, which may explain why they were using a lot of these tools. So we had weak service contrast and implementation fidelity rates that or usage rates that were lower, I think. Rachel, do you want to add anything to that?
No, I mean, I think those were the sort of main things we've been talking about.
Yeah, we found use of online program in the control group as well. That's like there is all sorts of different things that they use. Some with feedback, some not. Many have similar features, but I don't think there's one like that's very much like assessments or like having teachers use more systematically, giving them feedback and then looking at the report. So I think that's the special thing, like having the 4 step in the loop and really reinforce the use of data and giving student feedback, and teacher use the report to review work. So it's really like forming the loop. But I can see other programs doing like part of it, but I haven't seen one like doing all of it. Maybe that's the difference. But we also see that a lot of use of other program as well. But I can see that probably the usage will increase as like the remote learning comes. So the contrast would become even weaker.
Thank you both.
We were curious, like finding the effects in 8th grade. The treatment teachers used it in 7th grade. The students were exposed in 7th grade, and we wondered, especially in those smaller rural schools or in larger schools where teachers switch grades, it would be interesting to see whether in 8th grade they were those 7th grade teachers who weren't trained to use it in 8th grade, but they kept using it or they switched grades. Is that why you saw something in 8th grade? Was a question I had.
Yeah, that's possible. We're working with Christina and Jack, so that you know, like to pull the data, and we want to see the usage in 8th grade during the 2021 school year and see if that's explain the results a bit. But the analysis was all intent to treat, right? So we include everyone in the school.
I think the one other thing I would just add for those who haven't been thinking about this research quite as deeply or as long as we have is that, both, Mingyu's study and the one that Kirk and I have been working on was really motivated by the initial efficacy study that took place in the state of Maine. And I think our understanding is that there was definitely sort of more of a service contrast. So use this kind of tool was very sort of novel at the time, and it really created some differences in the experiences for the teachers and the students. And so I do think as we're sort of trying to look across the studies and really understand what we're learning and sort of the differences among them, that's an important sort of piece of the puzzle too, that at least in our study, there was just so much more similarity between what the teachers and the students were doing than in that earlier study. So I just wanted to add that as well.
Hi, I have a question for the adventure study. I wasn't really quite sure as you were presenting it. Were the students working collaboratively to get the friendship stones, and interacting with each other and talking with each other, or was this an individual task? And if they were working collaboratively, how did that work during the pandemic when they basically would have had to do it through things like this, through like Zooms like this?
Yeah, great question, Michael. Actually, the intervention was designed to be for students to complete it independently. And pre-pandemic, that was actually one of the sort of fidelity criteria that students worked independently. However, in our original design that we proposed and was accepted by IES, we were going to implement it as a tier 2 intervention with pulling students out of the classrooms. And when I started recruiting districts, they were like, we don't have the space, we don't have the people power to do that. Yeah. Can't the teachers just do it in the classroom? And at that point, it had only been studied in the home setting. So we said, yeah, that seems reasonable. And we did a pilot. And actually, Lin and I both went in and observed classrooms. And there was a great synergy that was happening, even though the students were working independently and we did multiple classroom observations. the students had some common language around, and one of the observations, we were waiting for the teacher to get some tech things addressed, and they actually thought I was one of the characters from the game. They thought I was like the Captain Co-op, because she had red hair, I guess, and I think that's actually like a really good title for me. And so they were talking to me, but what we saw in this pilot was that there was this great synergy, and the students were actually using some common language from the game, which we thought would be actually way more beneficial to the students who were behind in their social skills development, to have their peers have the same kinds of language, and that would actually help teachers to help the students generalize. So we ended up creating some discussion guides for the classroom teachers to help facilitate. So the students worked independently during the episode, but afterwards, the teacher would facilitate a classroom discussions about the concepts. And we thought that was really beneficial. And the teachers noted that students who normally were shy and didn't participate in classroom discussions actually participated in those classroom discussions. So that was a nice anecdote. Lindlin, anything to add?
You just described another study. So.
Yeah.
No, I think it's, even during the pandemic, some of the teachers were able to organize some small group discussion after the kids play the game and sharing about thoughts. So I'd like to see the interaction actually happened, not to say in the game itself, but actually during their day-to-day time, using some language from the game and sharing thoughts. And some students even kind of like using what the characters say to correct some other students' misbehavior. So I think that's the interesting part to see and observe.
Like a question for you, Mingyu, on intent to treat. Did you see that?
Yeah, I saw that. I was trying to type in some response. But I think all of us could weigh in, right? Because most of us has experience with this kind of large scale study, and WWC asked us to do the intent to treat analysis. That's what we do it first. But the dosage effect analysis is also nice. And like that's more realistically thinking that when this intervention is being implemented in more or less way, and then what's the effect there. So yeah, I think that's nice. For us is that the 8th grade analysis, like the long-term effect, that would not be feasible, but we could do that for 7th grade, like when students were using the intervention. But I guess that I'm trying to say is that I guess it wouldn't work for the long-term effect. But we are currently also looking at doing some exploratory analysis, looking at the usage in 7th grade, the relationship between 7th grade use and 8th grade outcomes, right? So how that correlate with each other. But that's somewhat different than what John has done with Adam, right?
Yeah, and Rachel and I looked at correlations between usage and outcomes for 7th grade and didn't see anything there, but curious if there are other ways of capturing dosage and other papers to read.
Well, I think the question, like you referred to Mingyu and Kirk's study, for our study, Kaide, I don't think we actually particularly mentioned about the dosage part in our presentation. But we actually did the analysis. We actually include the teachers and their classroom that meeting the fidelity expectation to look them separately, as well as putting into the model as 3 arms of the control with treatment meeting the fidelity expectation and treatment not yet at the meeting the expectation. We look at the data. The result is showing that even though the treatment group meeting fidelity expectation improving better, but the result is all of them actually improved. So even the treatment group with a certain level of fidelity, not meeting the expectation, also improved. So that's what we find out. We actually put that into the model to actually analyze the data. So that's on our end. Katie and I, we are putting together the impact paper, and in that impact paper, we are going to actually present both the overall group impact by different level of fidelity. Yeah, that's us.
Thank you, everyone.